Now we start scanning by placing a convex probe on transverse position at epigastrium area. Now we see the left lobe of liver. The liver shows heterogeneous texture, hyperechoic and hypoechoic texture. The margin of liver are smooth and regular. Here we see the pancreas, which is also echogenic or maybe heterogeneous texture. Commonly, the pancreas acquire the texture of liver. If liver is echogenic or hyperechoic, then pancreas will also hyperechoic due to fat accumulation. Here we see the uncinate process, head, neck, and body of pancreas. The size of pancreas appears to be normal or maybe less than 2 centimeter. Here we see the splenic vein. This is superior mesenteric artery and this is aorta. The pancreas is also normal and no mass or cyst or lesion seen. The tail of pancreas is obscured by duodenal gas shadows. Here we see echogenic gases in the duodenum. If we will give some pressure on the abdomen with probe, the duodenum will compress and gases will subside. Then we will see the tail of pancreas. Here we see some part of pancreas, and now this is clear picture of tail of pancreas. Pancreas is also normal and shows normal texture. If the patient has pain at epigastrium or at pancreatic area, then no need to compress with probe as pancreatic inflammation shows severe pain and tenderness at this area. So need to be carefully compress this area. Now we will scan the liver. This is right lobe of liver, which also shows heterogeneous texture. As we see through ribs, so their rib shadow is also present, which gives hypoechoic lining or shadows. Now we see no mass or lesion seen in the liver. Here we see the right kidney. And this is left lobe of liver. This is cranocaudal view. This is inferior vena cava. The normal diameter of vena cava is less than 2.1 centimeter. The gallbladder is absent. Patient had history of cholecystectomy due to gallstones. This is portal vein, which also normal. The normal size of portal vein is up to 12 millimeter. Now we will scan the CBD. It lies anterior to the portal vein. Here we see the CBD, which is also normal in size. The normal size of CBD is up to 6 mm. For CBD and portal vein, the position of patient should be left lateral and probe should be placed at mid-clavicular line at right hypochondrium area or between the ribs. Now we will measure the size of CBD. The size of CBD will be measured when you will clearly see the lumen. The size of CBD is 5.6 mm and post cholecystectomy the normal size of CBD is up to 10 mm. Now we scan the portal vein and again adjust the portal vein as a lumen to take the accurate measurement of portal vein. Now we will measure the size of portal vein. The size of portal vein is 7.5 mm, which is normal. The normal size of portal vein is up to 12 mm. Now here we see the right kidney, which is normal in size, and cortex and medulla are also normal. No mass, lesion, cyst or stones are seen. The cortex of kidney is always hypoechoic than liver. When there is pathology or cortical abnormality or parenchymal disease, the cortex will be same as liver or increased echogenicity will be than liver. Now we will scan the left kidney. The cortex and medullary part of the kidney is also normal and no mass, lesion, cyst or stones are seen. Now we will scan the spleen. Here we see the spleen. The texture of spleen is a little bit coarse or hypoechoic as the size of spleen appears to be normal, and this is diaphragm and echogenic line, and this is costophrenic angle of lung. Here we will see the pleural effusion if present. Now we will measure the size of spleen. For that need cranocaudal view of spleen. The size of spleen is 91 millimeter or 9.1 centimeter. The normal size of spleen is up to 12 centimeter or 120 millimeter. Now when we will scan the spleen, we see a well-defined echogenic or hyperechoic mass anterior to the spleen or subdiaphragmatic area. It is clearly differentiated from the splenic texture as spleen is hypoechoic and the mass is hyperechoic. Here we see the blood vessel in the mass. This mass lies between the left subdiaphragmatic area and spleen. First, it gives appearance of hematoma or blood collection as patient has history of road traffic accident, but patient has no history of pain or trauma at left side of chest, and the texture of spleen is also smooth or hypoechoic. No injured part of spleen is seen. On color Doppler, flow is also present in this mass. Now we will measure the size of this mass. The size of mass is 105 into 55 millimeter or 10.5 into 5.5 centimeter. Patient has no pain or history of cough or some irritation at this area. Now if we will correlate the texture of mass with the liver, we found that the liver and this mass shows similar structural appearance and echogenicity. The size of liver is 15 centimeter or 154 millimeter. The urinary bladder is partially filled. No free fluid seen in the pelvis. If there is abdominal injury in the trauma, we will see the fluid at this area. Here we see the uterus, and the endometrium is echogenic, which shows a foreign body or intrauterine device. The intrauterine device appears as echogenic. When intrauterine device is properly placed, its one end is seen at fundal area and second at lower segment area. If it is not in proper place, then one end will be seen in the cervix or second in the lower segment. The uterus is retroverted and antiflexed as its fundus is away from the bladder or posterior to the cervix. The size of endometrium is 10 millimeter, which is normal. The normal size of endometrium is up to 12 millimeter. This echogenic line is intrauterine device between the two endometrial layers. Now how we will write report. Liver is normal in size 15.4 cm and shows heterogeneous texture, no mass or lesion present. Gallbladder is absent as patient had history of cholecystectomy. Portal vein and CBD are normal. Both kidneys are also normal in size and shows normal echogenicity. No mass, lesion or stone present. Spleen is also normal in size 9 cm. A well-defined heterogeneous mass size 105 into 55 mm present between the left diaphragm and spleen. On color Doppler, internal flow present. The texture of this mass when compared with the texture of liver, they are closely resembles with each other. Urinary bladder is partially filled. Uterus is retroverted. Endometrium is normal in size 10 millimeter and the normal size is up to 12 millimeter. An intrauterine device is present which is at normal location or in situ. The ultrasound diagnosis is accessory lobe of liver and it develops separately.